Okay, good morning, good afternoon, good evening po sa lahat. Welcome to our 155th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And to all those who have just discovered us for today, welcome po. Sana po marami po kayong matutunan sa ating webinar sa araw na ito. Rhythmic shaking called tremor or panginginig, it usually begins in the limb, often in your hands po or in your fingers. The extremity po may tremble when it's at rest. The shaking may decrease when performing tasks. And tremors po, whether caused by, ito po ay essential tremor or dahil sa Parkinson's or dahil sa other neurological conditions, they can significantly impact an individual's quality of life. So ang tanong po natin, bakit po ito nangyayari at may lunas na po ba para rito? Yung pong mga conventional treatments have provided relief to some extent, but often come with limitations and side effects. May mga bago pong non-invasive methods for treating the tremors of Parkinson's and other causes. In particular, as you will note in our title, in our poster, we will take a closer look on HIFU, high-intensity focused ultrasound, using ultrasound waves to burn out the areas of the brain responsible for the tremor. Advantage po nito, you do not need to perform brain surgery or use anesthesia. And the patient undergoes the procedure now fully awake and can notice a decrease in tremor immediately after the surgery. So yun po ang pag-uusapan po natin sa webinar sa araw na ito. I'm Dr. Raymond Francis Sarmiento, Director, National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Fridays. And today, I'm again joined by our adjunct research faculty at the National Telehealth Center, also international renowned public health communications expert, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, Raymond. Good afternoon. Magandang hapon po sa inyo lahat. And hello to all of you who are with us on the live broadcast inside Zoom. We would also like to greet all those who are watching on TVUP YouTube channel, as well as the UP System Facebook page, TVUP Facebook page, Stop COVID Deaths Facebook page, and of course, those who are watching from TVUP Signal Channel, 101. Sorry, nadulas ako. TV Channel 101. And I'd like to greet all of you who are watching on the playback. Maraming mga busy pag Friday noon time, pero humahabol sila sa ating mga playback. Today we will have a very interesting discussion on tremor management, yung tinatawag nga na panginginig. Talk about emerging technologies, the challenges faced by patients, and the health professionals who have to deal with it. So we have interactive Q&A sessions to allow you to engage with our experts directly. And we would like to foster a really good discussion because this is a highly specialized topic, but we should all know about it. Kasi pag meron tayong kamembro ng pamilya na biglang nanginginig, hindi natin alam anong gagawin natin. So we want to learn from our experts and we bring you only the best speakers on Stop COVID Deaths. So one of our country's foremost neurosurgeons of the PGH Division of Neurosurgery, Dr. Jet Aguilar, who is our main speaker, and Dr. Carissa Paz Juquino, who is the chair of the Department of Neurosciences. And they will share their insights into the mechanisms behind HIFU, which utilizes, excuse me, Raymond. Raymond, come on.
No problem. So talking about HIFU, the utilizing ultrasound waves to target thermally yung pong ating mga specific brain areas that are responsible for tremor. So hopefully we'll be able to learn the minimal risk and yung mga outcomes po na nakita sa mga clinical trials and how it really improves patients' mobility and daily activities. Of course, we will have our synthesis and closing remarks delivered by Dr. Stella Jose, who is the head of the PGH Office of Expanded Education and Training. Dr. Susie?
Okay, sorry. Ako nabulunan. Sige. So as you've seen on our opening billboard, we're not just talking about COVID, but we also talk about other conditions. And we know that you like to keep abreast and to be aware of the latest in health and medicine. And it's for this reason that we bring you the news.
TVUP, may we have the cue? Okay, thank you so much for our very first news update. Childhood immunization begins recovery after COVID-19 backslide. So meron pong new data from the World Health Organization and from UNICEF, the United Nations Children's Fund, showing promising signs of immunization services rebounding in some countries, but particularly in low-income countries. Coverage still falls short of the pre-pandemic levels and thus putting children at grave risk from disease outbreaks. So according to data published in last July 18th by the World Health Organization and UNICEF, in 2022, 20.5, so 20.5 million children missed out on one or more vaccines delivered through routine immunization services compared to 24.4 million children in 2021. So in spite of this improvement, the number remains higher than the 18.4 million children who missed out nung pong taong 2019, which is before the pandemic disrupted our lives. So kailangan po talaga i-emphasize yung need ng ongoing catch-up para sa pagbabakuna ng mga bata, recovery, and strengthening of our system, yung pong efforts na iyon. Dr. Susie?
Okay, the link between gout and depression. Gout is a form of arthritis that causes intense pain, redness, and swelling of the joints and extremities. These are the physical complications of gout. But if gout is not treated, it can include high blood pressure, heart attacks, diabetes, kidney problems, obesity, and now researchers are taking a closer look at another health challenge, and that is depression. Based on a study of the University of British Columbia, they found a significant increase in gout patients who also have a mood disorder. But the researchers believe it's possible that this number may be higher than what they're seeing, and that this is because men who are more likely to have gout than women don't seek treatment for psychological symptoms, such as women who are more open to seeking treatment and diagnosis of depression. Previous research found that gout patients had a 29% higher risk for depression. So that's our news for today, and we'll be back next week with more news for you on the News Update. Okay, sorry everybody, nalunan ako eh. Parang, oh my gosh, ano ba yun? Thank you, Raymond.
No problem.
Salo, pero pag nabulunan ka, hirap, no? O sige, okay. So let's go now to, may housekeeping ka muna, Raymond?
Yes, thank you, Dr. Susie, for a little bit of and we'll let Dr. Susie take a break po muna, no. Before we go into our webinar proper, really on discussing HIFU treatment for tremors, we wanted to make sure that everyone is aware na meron po tayong mga nagre-request ng mga certificates of attendance. So for those who are requesting these certificates of attendance, it will only be given to those who watch at least 50%, kalahati po ng webinar po natin. For those who are asking, particularly kasi we were scanning our messages din po, no? Particularly for webinar 150, yung po yung sa may rising sea level, sa may climate change, that is still being signed off po by the Climate Change Commission signatory. It's already with them, and we hope to be able to receive them within the week so that we'll be able to complete yung pong sending out of all of the certificates. We've already sent out all the certificates for webinars 1 to 154 with the exception of 150. And if you have any questions, please feel free to email us at stopcoviddeaths@up.edu.ph. So before we go into the webinar proper, we'd like to set our discussion into context by watching what we call our person on the street video or POTS video. So we interviewed po mga nurses and those who really have been affected po nitong condition na tremors po, panginginig, no? So ang tanong po namin, ano po ang alam ninyo tungkol sa panginginig ng kamay, paa o ulo? At may kilala po ba kayong nagkakaroon ng episodes ng panginginig na mukhang hindi naman gumagaling. Sa tingin po ba nyo ay may lunas ito? Please watch this.
Knowledge ko about this is merong mga involuntary movement sa ating katawan, especially sa kamay at sa paa.
Ang alam ko po dito, yung sinasabi ng mga matatanda sa probinsya sa atin na pasmado, yung pasma na sinasabi nila na kapag nanginginig ka kapag pawis yung kamay mo, halimbawa naligo ka, napagod yung kamay mo, manginginig yung kamay mo. Yun yung isa sa alam ko. Pero
Inisip ko yung panginginig, naisip ko trembling, which usually ends up with Parkinson's diseases. Trembling of the hands and the feet.
Pagkamay at saka paa, parang mostly associated sa parang usually pasma, 'di ba? Or mga pagod. Pero bukod doon, ang alam ko, siguro may kaakibat na kondisyon, na sakit. Bukod sa panginginig na hindi na gumagaling, siguro ang naisip ko Parkinson's.
So pag may nafe-feel tayo, involuntary movement or biglang gumagalaw or hindi natin napapansin, biglang may nginig sa kamay o sa paa o sa part ng katawan.
mas malalim na dahilan ng panginginig kasi pwede siyang simptomas, 'di ba, ng mga mas malalalang sakit tulad ng Parkinson's, mga ganon, na brain degenerative diseases talaga.
Not personally, pero may mga na-encounter ng patients na may Parkinson's na nag-undergo ng surgery ng deep brain stimulation.
Actually, meron akong kaibigan na may pinsan siya na may ganitong sakit. For example, may instance na may hawak siyang gamit or baso tapos bigla na lang niyang mabibitawan kasi wala na siyang control sa muscles niya o sa katawan niya.
Mga pang-araw-araw na aktibidad katulad ng pagkain ng tama. So, syempre pag sumusubo ng pagkain sa kutsara, syempre dahil sa panginginig, pwedeng makadisrupt to sa pagkain nila.
Common ito sa mga matatanda at usually sila yung at risk. At ang usually naririnig ko about this, ang common dito ay Parkinson's disease.
Family friend po namin siya. If I remember correctly, parang meron siya talagang Parkinson's disease kasi meron talaga siyang mga moments na nanginginig siya. Grabe palang epekto ng panginginig sa katawan ng tao dahil involuntary siya, hindi siya napipigilan. Yung katawan niya, sobrang payat niya. Kasi syempre, alam mo yon, walang madaming nabuburn na calories, yung muscle niya, hindi nabibuild. Ayun, so, nahihirapan din siyang huminga, gumalaw. Nahihinder talaga yung everyday and day-to-day activities niya.
Usually kasi irreversible o hindi na talaga gumagaling yung mga nagkakaroon ng ganitong nerve damage. So, nagpa-perform ng mga surgery tulad ng deep brain stimulation na nag-iiwan ng implant sa loob ng katawan para ma-regulate yung nerve stimulation.
I think, yes, meron naman na sigurong lunas para sa mga ganitong sakit. Kailangan lang talaga ay mag-seek tayo ng help, lumapit sa doktor o sa specialista na may alam tungkol sa sakit na to.
So far, wala talaga. Pero we try our best para ma-minimize, ibig sabihin, yung trembling.
Personally, hindi naman ako medically inclined. Pero yung kakilala ko, sabi, wala daw po talagang lunas doon. Hindi siya nawawala. Napipigilan lang siya, pero habang buhay nang meron ng panginginig.
Well, unang-una, take note nyo kung ano yung mga naging behavior, ano yung mga pagbabago mula dati hanggang ngayon, kung nag-worsen ba. I-note nyo yung lahat, tapos para lahat may i-report sa doctor para tama rin yung maibibigay na treatment. Kasi paminsan hindi lahat kaya ng gamot. So, titignan kung kayang gamatin, kung kayang bigyan ng surgery, or kung pwedeng through rehabilitation.
Thank you very much, TVUP. It's always great to hear what ordinary people think about the topic. And Raymond, it seems they're very well informed. And I think we'll learn a lot more also with our experts today. But thank you, TVUP, for getting those persons on the street views. Raymond, over to you.
Thank you, TVUP. Thank you, Dr. Susie. So very important po, no, that there are those who have maybe kung hindi man sila, may mga kakilala sila and at least they are aware or at least informed kung ano yung nangyayari po sa kanila. And hopefully, this webinar will help bridge po kung ano po yung kailangan pa po nila malaman tungkol sa mga tremors or panginginig. For our webinar today, we'll be having a standard panel discussion format. And after our speakers have presented, that will be followed with a Q&A session. So please put in your questions if you already have questions po, no? Dito po sa ating Q&A box, or if you're watching outside of the Zoom, whether in YouTube or in Facebook, please put it in the comment section po. But before we delve into the webinar, we have a cute intro video for our fun quiz segment for today.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Talagang Raymond, Little Mermaid, dapat maging Mission Impossible na yung next na.
That's true. Thank you, TVUP. Can we have it? Okay. Can we have it also on the screen yung pong ating, there we go. Okay, so meron po tayong dalawang katanungan for today's webinar. For our first question, ano po ba yung common causes of tremors po? Ito po ba ay Parkinson's disease, essential tremors, dystonia, or all of the above? We'd like to take this opportunity to greet po those who are joining us from the Provincial Health Office in Kaanawan, San Jose, Nueva Ecija, from Central Philippine University College of Medicine, City of Pasig in Iloilo, from Camp Navarro General Hospital in Zamboanga City in Zamboanga del Sur. Meron din po mga nanonood from the National Kidney and Transplant Institute, NKTI, from Cagayan Province, from New Sinai School and Colleges. Maraming salamat po. Binyan, Laguna, and Cavite. Thank you so much. From Hospital ng Binyan, from Iloilo City, from UP Los Baños, from Bataan, nanonood din po, from MDRRMO Castillejos in Zambales, from Davao City, from University of Rizal System Health Services. Thank you so much. Doon din po sa mga nanonood po sa atin sa Cavite, sa DOST, National Research Council of the Philippines. Maraming salamat po. For question number 2, ang question number 2 po natin reads, what are the treatment options for tremors? Is it A, oral medications? Is it B, deep brain stimulation? Is it C, lesioning or HIFU? Is it D, all of the above? So we'd like to greet those who are joining us internationally naman po. From the Chonin Hospital in Taipei City in Taiwan, from University of Hail in Hail, Saudi Arabia, from Al Meswak Dental Clinics in Taif, Saudi Arabia, from Canadian Medical Center in Dammam, Saudi Arabia, from Vancouver, British Columbia in Canada, from Belvedere, London, England, and from Edison, New Jersey in the United States po. So thank you so much sa mga nanonood, and hopefully you'll be able to remember po kung ano po yung tamang kasagutan. We'll ask them to our experts towards the end of the webinar. Dr. Susie?
Okay, so as we promised, we bring you only the best speaker. It is my privilege to introduce one of the leading neurosurgeons of our country na classmate ko. O, di ba? Proud ako kasi itong ating presenter ay he's into astronomy, and actually an asteroid was named after him. Kita niyo naman yan. No, may asteroid that's named after him. So
nag-opera sa utak pero has time to look at the heavens.
Nako, talaga naman. Pagka nakita mo yung mga photography niya, Raymond, ng moon, ng kung ano-ano, talagang ibang klase. Okay, so we'd like to welcome Dr. Jose Francisco Aguilar, or Jet Aguilar as we call him, and he will be our main speaker for today. Jet, welcome to the webinar and thank you for joining us.
Hi, thank you so much, Susie. Thank you, Raymond. So, will I share my slides
Yes, sir.
now?
Go ahead and share your slides.
Thank you.
Sige, go ahead. Jet, go ahead.
Ayun, okay.
It's showing now.
Yes,
Yeah,
sir.
it's good.
Go ahead.
It's good now. Yeah, let's go.
Okay. Thank you again. Thank you for having me. It's an honor. And thank you so much for allowing us to present our humble experience in the using the latest modality of treatment for movement disorders, which is high intensity focused ultrasound, or it is also known as MRG FUS or magnetic resonance guided focused ultrasound. For my disclosures, I underwent training on the Exablate Neurosystem HIFU device at the Philippine General Hospital by the vendor, the Insight Tech company, and I have also received training travel grant from them. Aside from that, I have no financial gains or conflicts of interest related to this presentation. Let me start by showing some videos of famous personalities who have been diagnosed with Parkinson's disease to demonstrate its tremendous impact on their quality of life. Of course, one of the most famous ones is none other than Pope John Paul II, who suffered from Parkinson's disease during the later stages of his remarkable life. There is also Muhammad Ali and Michael J. Fox.
Americans like me. Your instinct will be want to put your hand in.
You can see the Parkinson's disease tremor that they are having, aside from the other symptoms. And the question is, would they have benefited from HIFU treatment?
What do you do in Missouri?
Let me explain first what causes the symptoms of Parkinson's disease. It had been shown that patients with Parkinson's disease have a progressive loss of cells at the part of the midbrain called the substantia nigra, and this leads to decreased brain dopamine production. Current understanding of movement disorders is based on the functional anatomic model of the basal ganglia by Dr. Malon DeLong, who described two parallel basal ganglia circuits known as the direct and indirect pathways. Low levels of dopamine cause an imbalance of direct and indirect pathways. Due to these, structures in the brain, like the subthalamic nucleus and the globus pallidus, which are our targets, become overactive. And based on Dr. DeLong's basal ganglia functional model, as illustrated here, it is postulated that the effect of substantia nigra degeneration affecting the direct and indirect pathways leads to the clinical manifestations of Parkinson's disease. This model actually is very helpful for us to understand how pathologies and surgical interventions in the basal ganglia affect our patients. So what are the possible treatments for movement disorders that we can avail of? This would include pharmacologic treatment with levodopa to replace dopamine, surgical lesioning like radiofrequency thermoablation, deep brain stimulation surgery, and recently high-intensity focused ultrasound lesioning. The possible mechanism of action of lesioning procedures and DBS is to suppress or modify the abnormal networks in the basal ganglia. Ablative lesioning procedures for movement disorders have been with us for a long time, since the 1940s. The objective of lesioning procedures for neurological disorders is the precise and selective destruction of a targeted volume of cerebral tissue, and in the process, interrupting maladaptive cerebral networks and destroying abnormal brain. However, almost all ablative neurosurgical procedures stop with the introduction of effective drug treatment of movement disorders, in particular, levodopa for Parkinson's disease, which was introduced in 1968. However, in the 90s, the emergence of neuromodulation procedures like deep brain stimulation surgery also suppressed lesioning or ablative procedures. However, it is just recently when we have seen the revival of lesioning procedures because of the introduction of more advanced technology like HIFU. And this is partnered with also with advances in neuroimaging like magnetic resonance imaging. Basal ganglia lesioning or neuromodulation for movement disorders usually involve three main targets: the VIM nucleus of the thalamus for essential tremor, and the globus pallidus and the subthalamic nucleus for Parkinson's disease and dystonia. Recently, there is the revival of another target, the pallidothalamic tract or PTT for the treatment of Parkinson's disease and dystonia. Due to its small size and more medial location in the brain, the PTT is a relatively easier target to lesion with HIFU compared to the globus pallidus interna. Like surgical lesioning procedures, however, high-intensity focused ultrasound was actually present already during the 1950s. Pioneering work by the Fry brothers William and Francis of the University of Illinois in the United States demonstrated that focused ultrasound energy could safely produce targeted neural destruction with almost no adverse effect on the surrounding structures. HIFU was produced by piezoelectric transducers, which produces the ultrasound energy, and this causes an increase in tissue temperature. This HIFU-induced temperature rise leads to protein denaturation and DNA breakdown, and eventually coagulative necrosis. In brain tissue, a temperature of 56 or 57 degrees centigrade or more than 1 second is enough to produce irreversible tissue damage or a lesion. During the 1980s, focused ultrasound had to be done with a craniotomy to overcome penetration of the skull, hampering energy deliveries. However, during the 90s, remarkable advances in technology and physics increased the accuracy and transmission efficiency of focused ultrasound, markedly improving with the development of, and this was also facilitated by the development of imaging and ultrasonic technologies. The development of multiple phase array techniques of ultrasound transduction improved ultrasound penetration of the skull. And this allowed the ultrasound energy to penetrate the skull without doing a craniotomy, and thus enable us to do non-invasive sonication of deep brain structures. And like I said, MRI, in particular MRI thermometry, allowed the verification of target location and real-time monitoring during the whole treatment procedure. This is the Insightec Exablate Neurosystem HIFU device, which the Philippine General Hospital acquired in 2020 through our director, Dr. Gap Legaspi. And this is the only existing one in the country to date. HIFU lesioning is firmly based on clinical evidence. This is now a well-studied modality of treatment, including several randomized controlled trials. In 2016, Elias et al. Conducted a blinded sham-controlled randomized trial of focused ultrasound thalamotomy for medically refractory essential tremor in comparison with the sham procedure in 81 patients from 8 international institutions. HIFU thalamotomy in this trial led to an improvement in tremor severity ratings by 47%, starting at 3 months and persisting throughout the 12-month study. The patient's disability scores and quality of life also significantly improved at 3 months and 12 months follow-up. The most frequent treatment adverse effects noted in this study were paresthesias in 38% and gait impairment in 36%. After this randomized clinical trial, HIFU for essential tremor was approved by the US FDA in 2016. HIFU had also been approved by the US FDA in 2018 for the unilateral treatment of tremor-dominant Parkinson's disease. What are the advantages of HIFU over the other modalities of treatment for movement disorders? For example, like radiofrequency lesioning or deep brain stimulation. As mentioned, HIFU treatment can be monitored in real time with MRI and MR tomography, allowing for immediate confirmation of the targeting process. Thermal lesioning can be performed discreetly and accurately and can be evaluated immediately. There is no surgery, no scalp incision, no borehole, and no electrode penetrating the brain. Since there is no open surgery, the risk of hemorrhage is reduced and there is no risk of infectious complications. There is no implanted hardware like in DBS, no need for extensive follow-up for device programming, and no need for periodic battery replacement. And it will be possible to retreat a patient who develops recurrence of symptoms if the disease progresses. Of course, HIFU treatment also has its disadvantages. Only one side can be treated at a time due to potential adverse effects of bilateral lesioning. Not all patients can undergo HIFU lesioning. Patients with a low skull density ratio less than 0.35 cannot undergo HIFU treatment. Brain targets are limited by size and position. Relatively larger targets like the GPI, which are more laterally located, are technically difficult to undergo HIFU lesioning. HIFU is a one-time procedure with risk of long-lasting side effects from off-target brain injury as well as concerns regarding the permanency of its symptomatic benefit. Patient head has to be fully shaved for the procedure. Here are the steps for the HIFU treatment session that we have previously described. Prior to the procedure, a head CT scan had already been done to compute for the skull density ratio or SDR with a value of 0.4 considered acceptable for the patient to undergo the procedure. Step 1 during the procedure day is patient preparation, which includes head shaving, stereotactic frame fixation under local anesthesia, silicone membrane application, and attachment to the transducer and MRI. MRI imaging is then done in the treatment suite, and target planning is performed in the HIFU workstation to set the target stereotactic coordinates. The final step then involves test sonications at subthreshold temperatures for target verification before delivering the final high-power lesioning sonication to the target, with real-time clinical assessment of the patient for therapeutic effects and adverse effects. For essential tremor, one can ask the patient to do the Archimedes spiral drawing test to assess therapeutic effects and clinical improvement with the HIFU treatment. Shown here is the lesion sonication procedure from the HIFU computer console. And here, one attained an average lesioning temperature of 57 degrees centigrade at the area of the right VIM nucleus, as shown. Here is our first case of HIFU treatment at the Philippine General Hospital. The patient is a 67-year-old man with disabling tremor-dominant Parkinson's disease on his left upper extremity, unresponsive to medications. He underwent HIFU lesioning of his right VIM nucleus, as shown here with the red arrow. His left upper extremity tremor almost completely resolved immediately after treatment, and he exhibited no post-treatment adverse effects. Here is another case of tremor-dominant Parkinson's disease, which we also treated at the PGH. This patient had severe bilateral tremors, unresponsive to medications, and the patient opted to have the tremor on his dominant right hand treated with HIFU lesioning of the left VIM nucleus. Treatment of the other side can be done in a staged manner, most probably after 6 months to 1 year, if the patient had no adverse effects after the first treatment. We retrospectively reviewed our first 15 cases of tremor-dominant Parkinson's disease who had undergone unilateral HIFU VIM thalamotomy at the PGH since 2022. The patients had a mean age of 61.7 years and a mean duration of illness of 7.5 years. Post-HIFU thalamotomy, there was an immediate improvement of their mean UPDRS3 scores by 37%, which further improved on follow-up. Adverse effects were transient, consisting mostly of treatment-related headaches and nausea. Now, allow me to go into another movement disorder that we are treating with HIFU at the PGH. I would like to explain briefly the unique Filipino movement disorder, which is X-linked dystonia Parkinsonism. XDP is an adult-onset dystonia affecting males with origins from Panay Island. This was first described by the Filipino neurologist Dr. Lillian Lee in 1976. Its prevalence rate in the Philippines is 0.36 per 100,000. Patients usually develop dystonia on their 3rd to 4th decade of life. Then Parkinsonism coexists or replaces dystonia after about 10 years of illness. Genetic studies of XDP has demonstrated that there is a mutation of the Tata-Box protein-associated factor 1. XDP is classified as a heredodegenerative dystonia. Here's the March 1969 UP College of Medicine Medical Grand Rounds Protocol showing when XDP was first medically discovered in 6 male patients originating from Panay. We have started doing HIFU lesioning procedures for X-linked dystonia Parkinsonism this year at the PGH, targeting the pallidothalamic tract or PTT. This is an ongoing clinical trial approved by our IRB and registered at clinicaltrials.gov. We have done 2 bilateral stage PTT lesioning and 2 unilateral procedures. Both unilateral procedures had an immediate significant improvement in their dystonia scores up to 81%, as well as one of the unilateral procedures. These initial results seem to indicate that bilateral PTT lesioning for XDP could be beneficial for these patients. Here is our first case of stage bilateral pallidothalamic tract HIFU lesioning showing significant improvement of his dystonia. One can see the bilateral PTT lesions on the MRI image shown on the left, with the latest lesion on the right side pointed by the yellow arrow. The second lesion was done more than 1 year after the first, which was done in Taiwan. Advances in lesioning technologies and neuroimaging have seen the revival of ablative procedures for the treatment of neurological disorders, in particular, high-intensity focused ultrasound. HIFU is comparable to other lesioning modalities for movement disorders in terms of safety and efficacy and has some added advantages. There is class 1 evidence supporting its safety and efficacy in the treatment of essential tremor. HIFU seems to be safe and effective treatment for tremor-dominant Parkinson's disease, as shown by our preliminary results of the first 15 cases treated at the PGH. Exploratory HIFU treatment using the PTT target for Filipino patients with X-linked dystonia Parkinsonism was presented with promising results. Thank you so much. This is from the PGH HIFU team. You can also see here Dr. Gap Legasti, Dr. Eva Cotionco de la Paz, and our neurosurgeon partner from Taiwan, Professor Chang, who helped treat our first XDP patients.
Wow, thank you so much, Jet.
Thank
My
you.
goodness, that's amazing, amazing work. No? Although yung prevalence, hindi masyadong maraming nagkakaroon ng ganito. Yung mga nagkakaroon talagang nagsasuffer sila and you could really see the difference. Thank you so much, Jet. Ako, sabi ko na nga ba, marami tayong matututunan.
Thank you, Susie.
Yeah, Raymond, ikaw naman.
Thank you, Dr. Aguilar. And for our reactor po, no, the reaction will be given by none other than the chair of the Department of Neurosciences, Dr. Carissa Joquino.
Thank you, Raymond. I will now share my screen.
Go ahead.
Would you like me to show you the video before the reaction? Or
It's okay. It's okay po.
yes, I'll show the video.
Yes po. Yes, ma'am.
Okay. So I will first share the video which was prepared by the department to share with others the HIFU treatment that is being done in PGH.
Ang Parkinson's disease ay isang tinatawag natin na neurodegenerative condition. So kadalasan ang mga tinatamaan nito yung mga medyo may edad na 60 and above. Pero may mga pasyente rin na mga mas bata, no? Nagkakaroon na rin sila ng Parkinson's disease.
Opo, si Wilfredo Tamayo, taga Barangay 3, Haro Leyte, 53 ma'am. I'm Rodolfo Lubis from Lipa City. I'm 68 years old. Nagpa-check up ako kayo. Tapos ginulihan niya ako ng Parkinson. Because of the condition that I'm suffering every day, I have to decide whatever it takes to cure my disease.
So ang mga sintomas ng Parkinson's disease, kadalasan may mga tremor sila o panginginig. nahihirapan silang maglakad. Yung iba nahihirapan tumayo o humakbang na nawawala ng balanse, so hindi na makasulat ng maayos, nagiging mabagal. So yung mga everyday activity, no? Pagligo, nahihirapan sila, pagkain.
Pagkain, hirap na. Ito na yung ginagamit ko. Ano yung paglagad ko, ma'am? Pag ganun na, nanawa na yung ulo, pati katawan. Pero hirap na rin po ako. When I was in the high school, way back in 1966 to 70, I got already my tremors. After so many years, my tremors really get hard. Lately, I can no longer stand very well. Somebody has to help me. But I hope that I can, by this time again, I can go back.
Ang pinakamalaking problema sa Parkinson's disease is that over time, no, yung gamot hindi na masyadong gumagana or umiiksi yung epekto. No? So makakarinig ka ng mga pasyente na after 2 hours, 3 hours, wala nang epekto yung gamot, so iinom na naman sila nung susunod. The newer option, at least here in the Philippines, would be the focused ultrasound or the high-intensity focused ultrasound.
Ano ba ang HIFU, no? O high intensity focus ultrasound? Ito na isa ring lesioning procedure na pinaliwanag ko, no? Na sinisira yung isang maliit na parte ng utak, no? Para po mag-improve ang sintomas ng Parkinson's disease o essential tremor, no? Lesioning siya na gumagamit ng enerhiya ng ultrasound, no?
So ang HIFU, ginagawa ito dun sa MRI suite. Nandito yung MRI machine. Hindi ito ginagawa sa operating room. Ngayon, bakit kailangan natin ng MRI machine? Ito yung magsasabi sa atin na sakto yung tinatarget natin lesion at hindi tayo tumatama ng hindi kailangan. At napakalinaw kasi nung binibigay na images ng MRI. So dahil dito, mas safe yung procedure natin. Importante sa ganitong procedure ay gising ang pasyente, no? At cooperative. On our part, we have to address yung mga side effects ng procedure at make sure na komportable yung pasyente, ma-address yung pain na maaari nilang maramdaman, pati na rin yung pakiramdam na pagsusuka, mabigyan din namin ng lunas yun. Kasi this will all affect yung kanyang pag-iisip tungkol sa procedure na ito and yung comfort na merong mga nagbabantay sa kanya habang ginagawa yung procedure na ito.
Sa HIFU machine, no? Meron siyang mga mahigit 1,000 sources o emitters ng ultrasound na nakafocus sa isang maliit na parte ng utak. At gumagawa siya ng lesion. Ang maganda po sa HIFU ay hindi po kailangan ng surgery, no? Wala pong diwa, hindi binubutas sa bungo, katulad ng mga unang lesion procedures o mga lesion na ginagawa ngayon. At napaka-immediate po ng effect, no? So yun po ang advantage ng HIFU treatment at paano po siya ginagawa. I think that's good. I think the clinical team is happy with this mission already. Pag na-treat na po sila, talaga mag-i-improve po yung tinatawag na quality of life po nila. So talaga nakakapag-function sila ng maayos. At saka yung treatment po, napansin po namin na talagang maganda po ang kanyang response. Talagang immediate po na nawala yung tremor after the HIFU treatment. At yung po siya pagkatapos ng gawin ng treatment.
Nawala kaagad yung tremor ko sa kamay, mga 95% hanggang 97%. Tapos, sinubukan ko na ulit pagkain niya. Itong gamit ko, hindi na nakakalat yung pagkain ko. And thanks God, because it's really God who heals everyone. So, I know that this is God's grace for me to be in this situation, to heal me, for me to serve Him for a better and longer life. Nakakapagsulat na ako ng maayos. Nakakain na ng maayos. Nagdamit ako kanina sa sarili ko, mabilis na. Nagtag ko, pansin ko, okay nga ako. Maligayang maligaya ko kahit napapaiyak.
Dahil nagkaroon na tayo ng HIFU treatment, talaga pong magagamit po ito, ma-access po ng mga Filipino patient na meron pong movement disorders.
Wow,
Okay,
thank you.
that's the end of our video. I have to say, Raymond and Susie, I'm always touched when I see this video. And sa akin, nakakapangilabot at you tend to marvel at the wonder of technology. So I'm going to present now my reaction to the presentation of Dr. Aguilar.
Go ahead, ma'am.
Okay, can you see my slides?
Yes po, go ahead.
And Dr. Susie, okay. So good noon to all of you. Thank you to the hosts for inviting the Department of Neurosciences to present in this webinar. There are a few things I want to share with the audience actually before the open forum. And maybe also to put things in perspective. And in the beginning of the webinar, the man on the street was interviewed and they asked about tremors. And Dr. Raymond already told us, when you say tremors, you really mean a rhythmic shaking of the hands, the arms, the legs, and it can also involve the head or even the torso. And like the man on the street said, it is a symptom of other diseases, but also it can occur on its own. And we have common causes. Common causes would be too much caffeine, or the use of asthma medications, or ethanol abuse and ethanol withdrawal. People with thyroid disease may also have tremors. If you have low blood sugar, when you're hungry, you may have tremors. If you have a liver or kidney disease, some of these diseases will present with tremors. And even just stress or anxiety, when you are in these situations, even a normal person will have tremors. But tremors are also associated with other neurologic disorders, and these include stroke, multiple sclerosis, and as all of you know, Parkinson's disease. Now, there are cardinal manifestations of patients with Parkinson's disease. Tremor is one of the cardinal manifestations, and it is mainly a resting tremor or a tremor that is more severe during rest. And the characteristic of this tremor is that it is pill rolling. It is as if a patient is rolling a pill between his fingers with oscillations of 4 to 5 hertz. And this tremor can also be seen in the legs, the lips, the jaw, or the head. And like other tremors, it is exacerbated by anxiety, excitement, and stress. But Parkinson's has other manifestations. And the other manifestations include bradykinesia. And what we mean when we say bradykinesia is that there is a generalized slowness in the movement. So parang slow-mo gumalaw ang pasyente. And it is manifested as decreased dexterity of the fingers. So the patient would have trouble using buttons or tying shoelaces or even performing double clicks on the computer. And the patient may suddenly freeze while walking, and he cannot take another step. Or for some patients, while they walk, they tend to drag their feet. The next cardinal manifestation is rigidity. And when we say rigidity, we mean an increased resistance to passive movement of a joint. And in the patient, this can be manifested as decreased arm swing while walking or taking shorter steps. And when the doctor moves the joint in the range of motion, they can feel some kind of resistance. A fourth manifestation of Parkinson's disease would be postural instability. And so there is a decreased ability of the patient to prevent falling. And the patients tend to fall during the pull test. So during the pull test, we stay behind the patient and pull the patient backwards on the shoulders, and we observe how the patient catches the fall. So Parkinson's disease patients would tend to fall. No? So that's the reason why we stay behind to catch their fall. Now, there are other manifestations of Parkinson's disease. These include masked facial expression, parang poker face sila, micrographia, pag pinasulat sa papel, paliit ng paliit ang sulat nila. They have a stoop posture. They may have impaired attention, executive function, and maybe later some memory changes also. They may develop psychosis, mood disorders, or anxiety or sleep disorders. Oftentimes, they will complain of fatigue. Parang ang term often na naririnig namin ay low bat sila. And they may develop orthostatic hypotension. Now, in this slide, we here have the clinical diagnostic criteria for Parkinson's disease. And so for clinicians, to make a diagnosis of Parkinson's disease, we will, of course, look for the cardinal manifestations. And you have there bradykinesia +1 of tremor or rigidity. But clinicians will also have to check for the following. So we have cerebellar abnormalities, supranuclear gaze palsies, behavioral disturbances, Parkinsonian features restricted only to the lower limbs, treatment with a dopamine receptor blocker or dopamine depleting agent consistent with drug-induced Parkinsonism. An example of this would be metoclopramide. No? Absence of response to high-dose levodopa, cortical sensory loss, apraxias, aphasias, normal functional imaging of the dopaminergic system, and diagnosis of an alternative condition causing Parkinsonism, which could be causing the symptoms. So the presence of these features would actually suggest an alternate diagnosis. So if you have the Parkinsonism, bradykinesia, tremor, rigidity, plus some of these exclusion criteria, then this is not Parkinson's disease. However, there are characteristics that would support the diagnosis, and this would include a clear beneficial response to dopaminergic therapy. So the physician will put them on a therapeutic trial of levodopa, and if they improve, that would seem to suggest that the patient does have Parkinson's disease. The presence of levodopa-induced dyskinesia, that means these are additional movement disorders related to the use of the drug levodopa. And then rest tremor of a limb, the presence of either olfactory loss or cardiac sympathetic denervation on MIBG scintigraphy. So these are supportive criteria. In making the diagnosis, there are also certain features that should set the alarm for other things. And these include the rapidity in the progression of the gait impairment, because Parkinson's disease is some chronic, slowly progressive disease. The absence or progression of motor symptoms. So that means there is no progression in the symptoms, because we do know Parkinson's disease is a neurodegenerative disease. So there is a deterioration over time. Early bulbar function, dysfunction, inspiratory respiratory dysfunction, autonomic failure, recurrent falls because of impaired balance within 3 years of onset, because the recurrent falls would be more seen in the later years of Parkinson's disease. Disproportionate enterocolis or contractures, absence of any of the common non-motor features despite 5 years of the disease, unexplained pyramidal signs, and bilateral symmetrical Parkinsonism, because Parkinson's disease at onset is usually unilateral. So clinically established Parkinson's disease is diagnosed when you have one, the Parkinsonism, meaning the triad, or the bradykinesia +1, either tremor or rigidity, the absence of the exclusion criteria, and the presence of at least 2 supportive criteria. And for a clinically probable Parkinson's disease, this would be Parkinsonism, the features, plus the absence of exclusion criteria, and then maybe balanced numbers of supportive criteria and red flags. So after making a diagnosis, treatment is commenced. And this table shows the range of treatments for patients with Parkinson's disease. Dr. Jet actually showed this earlier. So we often start with medicines first or pharmacotherapy. And these include dopamine agonists like ropinirole and pramipexole, levodopa. If some of you know, there are intermediate release preparations and controlled release preparations of levodopa. We also have MAO inhibitors like rasagiline and selegiline. We also use amantadine and anticholinergics, and these two drugs are used for tremor, predominant Parkinson's disease. And we also use a lot of other drugs to help us manage the non-motor effects of Parkinson's disease. These are usually mood disorders and sleep disturbances, etc. Now, there is also non-pharmacologic treatment for Parkinson's disease, and I find that these adjuncts to the treatment are as important also as medications. So first would be education. The clinicians have to teach their patients about the disease, and they have to teach the patients to be sensitive to the effects of the medicines so that they can report to us what they are feeling. And when they give us feedback, we can better titrate the medications. Social support is important, so we encourage our patients to join support groups for Parkinson's disease. Importante din ang exercise, and if I feel that the patient cannot keep up with the exercise, they can make all sorts of excuses, they're busy, etc. I send them to therapy, formal therapy, and this is either physical, occupational, and even speech therapy. And nutrition is also important, and some of the studies actually they prescribe the MIND-DASH diet, which means the Mediterranean DASH intervention for neurodegenerative delay. So in more recent years, device-assisted and lesioning therapies like DBS and HIFU have been introduced primarily to help patients whose motor fluctuations are difficult to control with medications. And so that was what Dr. Aguilar presented. And in this slide, I showed more or less a comparison of the different treatments. So in this table, you can see that medications, which is the third column here, HIFU, which is the second column, and DBS, which is the last column, have low risk for long-term effects. But you can see here, thalamotomy, this is a direct surgical intervention, and you can see here that there is a high risk of long-term consequences with actual operation. Side effects can be managed through medications when you are just taking medicines, or setting adjustments in the deep brain stimulation. But for HIFU and thalamotomy, side effects may actually persist. Now, for both medication treatment and HIFU, surgery is not needed. No? And that was the beauty of HIFU, because there is no burr hole, there's no incision, there's no scalp incision. The fourth line indicates that thalamotomy, HIFU, and DBS are used for patients with medication-resistant PD, because the experience is that the medicines are, of course, not perfect, and some people will really need more than just the medications that neurologists can give. Finally, in terms of cost, there was one more line here, but I removed it because it was in another denomination. So in terms of cost, thalamotomy and DBS would be more expensive than HIFU or treating with medications. Now, in the previous slide, the last line indicated that lesioning treatment and DBS are used for difficult to treat Parkinson's disease. Taking a closer look at the basis for the US FDA approval for the use of HIFU in PD, we note that the approval was based on an RCT conducted by Bond et al. And some of you might be interested in looking at that article. It was published in JAMA Neurology in 2017. And so the study was performed on patients with medication refractory tremor dominant Parkinson's disease. And the total N for that study was 27. So 20 underwent unilateral focused ultrasound thalamotomy, and 7 had sham treatment. And they observed that the tremor score and the UPDRS motor score were better for treated patients versus the placebo group. There were side effects, and the side effects included mild hemiparesis, orofacial paresthesias, finger paresthesias, and ataxia. Thus, for now, the group of patients for which HIFU is being offered to as a treatment option are this medication refractory PD, and they are also tremor dominant Parkinson's disease. Abroad, trials are underway to determine if patients with Parkinson's disease with dyskinesias or dystonia will also benefit from HIFU. So you can look in the internet, there are trials ongoing. Patient recruitment is also ongoing for some of these trials. Now, the question is, how are the patients prepared for HIFU? And first, the diagnosis has to be ascertained. So we have to know if this is indeed, if the patient indeed has tremor dominant Parkinson's disease. And these are usually patients who present initially with tremor, with relatively mild bradykinesia and rigidity, and who progress slowly over many years, with tremor remaining as the most prominent clinical symptom, together with relatively mild bradykinesia, rigidity, and the absence of postural instability. So just for information, the other recognized subtypes of Parkinson's disease are the akinetic rigid type and the postural instability gait disturbance type. So after the diagnosis is ascertained, then medical treatment will be maximized. So the expert, and in our institution, it is Dr. Dominic Hamora, he will see if the medical treatment for Parkinson's disease of this patient really has been indeed maximized. And evaluations will be performed at regular intervals. Neuropsychological evaluation is done primarily to detect mood or other behavioral disorders, and also to check the memory. And as you heard from Dr. Aguilar, a skull X-ray is needed also to determine the density of the skull table, because that would influence the penetration of the ultrasonic waves. Now, what are the other conditions that HIFU is used for? So HIFU has been approved for the following in the US and other parts of the globe. It has been used for depression, for essential tremor, and this is one of the FDA approvals back in 2016. I mean the US FDA approval. Neuropathic pain. It has also been used for obsessive compulsive disorder and trigeminal neuralgia. But also it is being studied for many, many other conditions like addiction, Alzheimer's, amyotrophic lateral sclerosis, ADHD, bipolar disorders, brain tumors, dystonia, epilepsy, and now the study of Dr. Aguilar and his colleagues, they are looking at HIFU for the treatment of XDP in the Philippines. So let me end with some thoughts for consideration. First, I hope you understood that not all tremors mean that you have Parkinson's disease. I think that's clear. Tremors are accompanied by other manifestations such as slowness and rigidity in patients with Parkinson's disease. And I think that HIFU thalamotomy indeed is a viable option for the treatment of tremor in patients with tremor-dominant Parkinson's disease. I do have to say that not all patients with Parkinson's disease are suitable patients for HIFU thalamotomy. So it's important to get evaluated. The body of evidence for its use in other conditions is still growing. And actually, I eagerly await the results of these various clinical trials. Since this is a new procedure, we really have to look closely at long-term effects, and we have to monitor them in the patients who have undergone HIFU. Finally, I cannot help but wonder if in low-income settings like the Philippines, will this million peso procedure be truly cost beneficial for Juan de la Cruz and the country? Certainly, for individual patients, this is marvelous. But is it cost beneficial for us, for all of us in the long run? So that's it, Sir Raymond and Ma'am Susie. Thank you.
Okay, thank you so much. That was Dr. Carissa Joquino, who's the chair of the Department of Neurosciences. Maraming salamat, ma'am, for that reaction and for the video that prepared by the department as well. Dr. Susie?
Yeah, thank you, Carissa. Very, very nice reaction. And we really appreciated the video and the very, what should I say, provocative questions at the end. Okay, so Raymond, we're going to have a little bit of a break. So we're going to ask Jet and Carissa to please open your cameras for a moment, but we're going to have a break. Go ahead, Raymond.
We'll take a very quick break lang po for our special public service announcement for today.
Happy birthday, Mahal!
Thank you, Mahal.
Happy birthday,
Happy
Mommy!
birthday,
Hi,
Mommy!
Dad! Hi, Mom!
Happy birthday!
Thank you, mga anak. Thank you.
Love you, Mommy!
Miss na namin kayo.
I miss you, both of you. I miss you.
Miss ko na kayong lahat.
Mommy, sana magkakasama na tayo muli.
Miss na namin, Mommy. Happy birthday, Mommy.
Miss and love you,
Mommy.
What did you wish for, Lola?
My wish, magpapabakuna na ako.
Ako din!
Dahil mahal ko kayo, magpapabakuna ako.
Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for COVID-19 vaccinations, especially now that the bivalent vaccines are available. So please share this video clip with all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. We'll start the ball rolling with questions now, Dr. Susie.
Yeah, thank you so much, Raymond. I mean, I think we've got some questions in the Q&A box, but I wanted to start by asking Jet and Carissa about when should frontliners start thinking about referral? Because most of our audience are general practitioners, nurses in primary care centers, doctors in district hospitals. When do you want them to start thinking about going to different types of modalities for treatment? Because I think there's limited availability right now. It's available, but it's limited. And I think what's the right time to introduce treatment like HIFU? Is it better if you do it earlier for those that are treatment resistant? Do people have time to, what are the considerations for referral? Jet, ikaw muna.
Thank you, Doc Susie. Very, very good question, no? Because after we showed that video, we got deluged by questions from patients, no? And what we actually have set up is, if possible, the patient should first be seen by their neurologist. And it is even a general neurologist would be able to do the proper screening and because the first important, like Dr. Carissa mentioned, we have to be sure that the patient's diagnosis is correct, that the medications have been optimized before we even think of the more advanced treatments like surgery or even HIFU. So dapat
Yeah,
makita muna ng neurologist.
so neurologist to the neurosurgeon. Carissa, did you want to add to that?
Yes, Ma'am Susie. So in my presentation, I said that there are cardinal manifestations of Parkinson's disease, and tremor is only one of the manifestations. And if you were looking at the diagnostic criteria, bradykinesia has to be present with either tremor or rigidity. So kung slow-mo yung tao tapos may tremors, yon isipin mo na baka Parkinson's ito at hindi lang yung iba pang causes ng tremors. So I think yung slowness is key to make the diagnosis in the primary health care. Yon.
Yeah, Carissa, while we're at wala ba ako? Okay, Carissa, while we're at it, there are many other symptoms of Parkinson's, no, like loss of smell or even sleep disorders. Can you run through that again? Because I think while we're saying that you want tremor dominant Parkinson's, meron pang ibang there are other signs of early Parkinson's. Could you talk a little bit more about that? I know you covered most of it, but maybe you can talk about it with a little more depth.
So some of the early manifestations of Parkinson's disease would be postural instability. No, they tend to lose their balance, and also sleep disorders are also one of the kind of like harbingers that the patient might have Parkinson's disease. And the specific disorder is the patients tend to actuate what they're dreaming. So if they're hitting somebody, you can see them during sleep, they're trying to hit somebody. Parang ganon, no? So those are early manifestations. But when Parkinson's is there, then the other manifestations include the stoop posture, like what I showed in the video, change in the handwriting of the patient, yung facial expression na parang poker face. These are some of the manifestations. There are also, one of the things is when they walk, they don't swing their arms. Normally when you walk, it's a normal arm swing. When that is reduced, that suggests that the patient actually might have Parkinson's.
Yeah, so I think what we're trying to say is, okay, you could have an index of suspicion if you're a nurse or a doctor in a primary care setting, but if you're seeing some of these things, you may want to refer to neuro, and neuro will determine whether or not, what kind of treatment could be available to the patients. But it's good to know that even for those that are not responding to medicines, there's something that can be done that's non-invasive. So I think that's the beauty of this presentation. Okay, Raymond, let's go to our Q&A.
Okay. Question. We'll ask it chronologically, no? Kasi po ano po siya. The questions that we have in the Q&A are as follows. So number 1 from Ma'am Maria Mercedes Maat. What if the Parkinson's manifestation more of muscular rigidity rather than tremors? Can you still use HIFU for that one?
Well, the answer there is no. Yeah, the answer there is no at the moment because we are only using it for tremor dominant Parkinson's disease. And like Dr. Carissa mentioned, there are actually ongoing studies on using HIFU to treat other symptoms of Parkinson's disease like rigidity and bradykinesia. But this is in a clinical trial setting. And actually, we're considering starting a clinical trial also at the PGH. To target, do different target to treat the other symptoms of Parkinson's disease. But we still have to start with it. We are not yet doing it.
So actually, if you were watching the video, Mr. Wilfredo Tamayo, aside from the tremor, I think the gait actually improved. Di ba, Jet?
Yeah.
No? So I think
It was
also
dramatic
there for
improvement, I
him.
think. Yeah, yeah. I have a
But
question. Yeah, go ahead. Go ahead, Carissa.
this is all still under study, so it cannot still be recommended. So if
Yeah.
the question was, can it be done? And so the answer would be not yet.
No, not yet.
Not yet. Okay.
Oh, pero very exciting, no? I mean, I think it's very exciting to see how new things are coming and to our countrymen, no, sa mga Pilipino. I have another question here on my phone, which is the effects of HIFU. Is it permanent, or would a person need to go through treatment again?
Great question also. Actually, HIFU just started maybe 2000, less than 5 years or 5 years ago. So all the follow-up studies have assessed patients only at more than 5 years post-treatment. And actually, the results seem to be good. I mean, but there are recurrences. Yeah, there are recurrences. But at least 5 years, we can expect that, for example, for tremors, it will persist. The beneficial effect will persist.
Ang ganda rin,
For
ano?
more than 5 years. Yeah.
That's really amazing. Okay, Raymond, meron ka pa dyan? Nakita ko may mga question pa dyan.
Questions, it's both similar po, no? And they're asking how expensive the procedure would be. My additional question would be, does PhilHealth cover it?
Wala pa. Unfortunately, it's not yet covered by PhilHealth. No? Some of the earlier patients, actually, most of the 15 patients I described, because it's PGH, they were able to avail of, I think, free HIFU treatment. But we do have, I think, 1 or 2 patients who were pay patients. And for that, what is being asked of us is to mention that the cost at PGH for the HIFU, if you will be a pay patient, would be about mahal din, no? Almost 1,800,000 pesos.
Yeah.
800,000 pesos.
But I would suppose, Jet, in time, right? Like all treatments, in time, the cost of treatment, especially if it's effective, will go down, di ba? Kasi ngayon lang kasi bago, pero ultimately, we would expect the cost to go down. And looking at the parang miraculous improvement, yung nakita natin dun sa patients mo, no? I don't know. I'm just very optimistic all the time. So I think it's a great thing.
A big part of the cost is actually the treatment kits, which we order from the company. So if we can negotiate with the company to bring the price of the treatment kits down, maybe that will also bring down the cost.
Yes. Okay. Raymond, meron pa dyan?
No more questions. I'm scanning also the ones in YouTube po.
Okay, go ahead.
Um
Okay, I have a question.
Go ahead.
This is my question. So, Jet, in terms of training our neurosurgeons to be able to do this, how much time does it take? And do you think that this should be like a skill that all the neurosurgeons should start studying?
Well, it's actually part of our subspecialty, which we call functional neurosurgery, which involves what we call stereotactic neurosurgery. And but as of now, here in our country, we have no training yet for functional neurosurgery, and they have to go abroad. And usually it takes about at least 1 year of training to be able to do it. But fortunately, at PGH, we might start one because we're doing a number of cases already, and the numbers might still increase. No, not only for HIFU but also for deep brain stimulation surgery. We're all doing it at the Philippine General Hospital already.
Nice. Okay, Raymond, ikaw.
I can't see questions. Let me pull it dito sa may sa aking phone. Question is about tremor. So Dr. Carissa mentioned, I think it's in her last slide or one of her last slides, that not all tremors are Parkinson's po, no? I think the question was, meron po akong nararamdaman na I think parang nagfa-fasciculate yata yung muscles niya involuntary every once in a while and then it just goes away. So it doesn't matter kung pagod siya or anything of that sort. Yun daw po ba ay panginginig? Part daw po ba yun ng panginginig?
Well, kasi Raymond, you used a certain term, you said fasciculations. But when you say tremor, yan ay visible motion along an axis or the joint, no? But when there is no movement on the joint, and let's say there's just a twitch or a twitch in the muscle, that would be more correctly called a fasciculation. So iba. So in tremor, what we're looking for is movement along an axis or along a joint.
Okay.
Raymond,
Yes,
please
ma'am.
allow me to acknowledge the presence of Dr. Lillian Lee. I can see her name here. She's the lady
Ma'am,
who
nandyan.
Ma'am,
described
good afternoon po.
Describe the condition in Panay.
Hello, ma'am.
Hello po.
And I can see also here the past chairman of the Department of Neurosciences, Dr. Cabralim. Hello.
Thank you so much po.
Oo, yan na nga eh. Yung mga faculty nanonood eh, no? Kaya anyway, so I'd like to thank our speakers. Wala na tayong questions, but I think we can go to the fun quiz, Raymond.
Okay.
Yeah.
Can we have it on the screen right now? Okay. So we have two questions and we also have the one in Slido. So for those who participated po sa Slido, when they type in slido.com and then enter the code 6510096. The questions po, I will have Dr. Aguilar answer the questions. Number 1, what are the most common causes of tremors? What's the correct answer, sir?
What are the common common causes? So if Dr. Carissa would agree with me, it's all of the above.
Oo naman. Pero the answer is all of this can be associated with tremors. But the real most common cause of tremors would be, I guess, essential tremors. Mas maraming may essential tremors than with Parkinson's disease.
Okay. For question number 2, thank you so much, Dr. Jet and Dr. Carissa. Question number 2 reads, what are the treatment options for tremors? Sige
Again,
po.
all of the above pa rin, no? Because they can avail of all of these treatments. But usually, it starts with oral medications.
Okay.
Oral medications. Okay. Thank you so much. So doon po sa mga sumagot, although we see in Slido 100% na nagsabi all of the above, in Zoom 82% lang po yung all of the above sa question number 1, and then for question number 2 it's at 87%. So now you know the correct answers po. Dito
Actually,
po
yung 2 all of the above pa rin, di ba, Carissa?
Yes, sir. Opo.
Yeah, it's all of the above pa rin.
So all of the above. Okay, thank you so much. So right now we'll be asking po our panelists for just to take a quick pause and try to come up with their maybe 1 or 2 minute last words or parting words po, no, that they will want to share with the audience. If there's anything that the audience would want to take away from the webinar, from each of your talks, yun po yung hihilingin po namin sa inyo. And while we're doing that, we will be going through the panel discussion poll. Dito po sa panel discussion poll pong ito na po yung evaluation poll po natin. Wala po tayong hiwalay na sinisend out na evaluation poll. It is comprised of 5 statements and we'll be asking you to put your assessment po on a 4-point Likert scale. So whether strongly agree, disagree, and strongly disagree. The statements po are as follows. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We encourage everyone to put in your answers po dito po sa ating panel discussion poll as we move on to the final messages from our speakers. Dr. Susie.
Thank you so much, Raymond. We'll start with Dr. Carissa Joaquino. Carissa, parting message.
Yes, ma'am. I think I gave a summary in the end, no? So not all tremors is Parkinson's disease. You need other associated manifestations to make a diagnosis. If I have to say that this HIFU thalamotomy is like magic for patients with tremor dominant Parkinson's disease. And so if you are interested in getting evaluated, the message should be go to the neurologist and have yourself evaluated so you can get a diagnosis, a proper diagnosis. For PGH, the diagnosis is made in the outpatient department. I understand the outpatient department is now open for walk-in patients. The neurology clinic is at room 132. And we have our clinics on Monday in the afternoons, 1 to 5, on Tuesday, 8 to 12, and also on Thursday, 8 to 12. So if there is a question in your mind about whether your tremor is from Parkinson's disease, please consult with a neurologist. Yun lang po.
Thank you so much. Thank you so much. Dr. Carissa Joquino is the chair of the Department of Neurosciences of the Philippine General Hospital. Okay, so we go to Dr. Jet Aguilar. Jet, go on, ma'am.
Thank you, Susie. I totally agree with Dr. Carissa. The HIFU treatment, if you look at the video, seems like a miracle, or like the patients would feel that, oh, I now have a treatment for my Parkinson's disease, but this is not true. No, this is far from the truth. It's just a symptomatic treatment, and it treats only a small subset of patients. And these are patients, for example, with tremor dominant Parkinson's disease and essential tremor. And the treatment is still evolving, and we are trying to explore new targets. So in the future, we will be able to treat Parkinson's disease. And what is nice about HIFU is it's available at the Philippine General Hospital, and we expect more patients because, as we all know, all of us, a lot of Filipinos are aging, and this is part of the change in the demographics. We still have a young population, but a lot of patients, a lot of Filipinos are going into that age wherein they would develop diseases like Parkinson's disease. So this is just a small part of the treatment. It's not a miracle cure, and you have to consult your neurologist to be able to make sure that you will be able to, you are qualified for this particular treatment modality.
Okay, thank you so much. That's Dr. Jet Aguilar, one of our leading neurosurgeons in the country. He is with the Department of Neurosurgery at the Philippine General Hospital. I'd like to thank both of you for your time.
You,
it takes
Susie.
time to prepare for the webinars, but you see the gratitude of our audience. Nagpapasalamat sila. They have mga emoticons and all of that, because we indeed did learn a lot. So to do a quick synthesis of our webinar today, I'd like to call on Dr. Stella Marie Jose, who's the head of the Expanded Education and Training Unit of the Philippine General Hospital. Stella, take it away.
Good afternoon, everyone. We have another very interesting webinar today from Dr. Jet Aguilar and Dr. Carissa Joquino. Dr. Jet Aguilar started with saying that ablative and lesioning procedures for neurologic disorders, the aim of which is for in selected patients, there is the selective destruction of a targeted volume of cerebral tissue. So they want to create therapeutic lesions in the brain to interrupt the maladaptive cerebral network. So he also explained the advantages of HIFU in the treatment of movement disorders. And he said that the advantage is there's not much blood loss, and there is no drilling of the brain, of the skull. And but also he explained the disadvantages of HIFU, and he said that not all patients can avail of high intensity focused ultrasound. So when a patient has a low skull density ratio of less than 0.35, they are not eligible for HIFU. He also mentioned about the XDP, or the X-linked dystocia Parkinsonism, which comes out in the fourth decade of life, and this is seen in patients in the Panay province. From the chair of the neurosciences, Dr. Carissa Chokino, she spoke on tremors and what can cause tremors. So, we all think that it's Parkinsonism, but it can also be due to caffeine, lack of sleep, and thyroid problems. So there are many causes of tremors. But he said that the cardinal manifestation of Parkinson's disease is tremors or resting tremors, bradykinesia, or generalized slowness, rigidity. So there's increased resistance to passive movement of a joint, postural instability due to the decreased ability to prevent falling. So, in the diagnosis of Parkinsonism, what is important is the patient has bradykinesia plus any two of the following. Most importantly, tremor and rigidity. So, for the diagnosis of clinically established Parkinson's disease, we have one, Parkinsonism. Second is the absence of the exclusion criteria, and three, at least two of the supportive criteria. So yan yung clinically established. Now, the probable Parkinson's disease, number one, you have Parkinsonism, and again, the absence of the exclusion criteria. And third is the balance number of the supportive criteria and the red flags. So I also suggest that you go back to the webinar, the recording of this, so that you will get all the details. So who will really benefit from HIFU? First is those with medication-resistant Parkinsonism and those with tremor-dominant Parkinson's disease. So she mentioned about the points to ponder that not all tremors are due to Parkinson's disease. So I think before you have to consult your neurologist so that you will get a better picture if you are eligible for this device. Thank you very much for listening.
Thank you so much. That's Stella Jose, the head of the expanded education training program of the Philippine General Hospital. Thank you, Stella, for a very concise summary of a very, very interesting webinar. And indeed, I am one of those who's going to watch this again. So next week, don't leave us. Ay, taka Raymond, you give muna the result. You give the results na?
Yes, po. We can give the results of the evaluation polls. Can we have it on the screen right now? Okay, so for the evaluation poll po, no, if you're able to see it on your screens, we were able to get 72% of our participants to answer it, and at least 91% of those, between 91 to 96% po ang evaluation sa ating webinar and sa ating mga speakers. So again, we would like to thank the Department of Neurosciences po for explaining something that's a little bit medyo mahirap po siyang intindihin in terms of if you were a tremor patient or a Parkinson's patient, but trying to figure out na hindi po yung nagtatapos sa inyong oral medications, lalo na po kung hindi po ito effective sa pagkontrol ng inyong tremors. We have another way that is short of deep brain stimulation po, which is the HIFU. We'd also like to mention po, ulitin ko lang po, hindi po lahat ng tremors ay Parkinson's, kasi may ganun pong notion ang karamihan po na baka nagkaka-Parkinson's na or anything of that sort. So thank you so much, Dr. Susie.
Yeah, thank you so much. And thank you again to our speakers. I think, sabi nga nila yung Parkinson's hindi ganun kadami ngayon, but with an aging population, and as we see in other countries, it's a huge problem. And so, huwag tayo mawawala ng pag-asa kung meron man tayong mga panginginig, and if that panginginig turns out to be Parkinson's, there are new things that are available for you. Okay, so next week, we have the Department of Orthopedics. And I announced that last time, nagkamali ako. Orthopedics tayo next week. So maraming salamat po, and thank you again to our speakers. Raymond, over to you.
Thank you, Dr. Susie. And thank you to Dr. Stella Mariose for our very, very accurate po and very easy to digest po na synthesis as part of our closing remarks. Before we conclude our program, we want to be able to remind everyone that all Stop COVID Deaths webinars po, lahat po yan ay makikita po ninyo from webinar 1 to webinar 154, and then after today, webinar 155. Ma-review nyo po yan if you go to www.youtube.com/TVUPPH, which is the official TVUP YouTube channel po natin. Dito nyo po makikita, you just need to scroll po dun po sa ating, I think in our live na tab, you'll be able to see all of our 154 webinars and then maging 155 after today. In the same channel, you'll also be able to see selected presentations po, no, which is what we call SCD shorts. Very, very short, consumable videos po that we hope you'll be able to watch kahit naghihintay lang po kayo sa kung saan. Watch them at your convenience at TVUP YouTube channel. We understand everyone's very busy, but we hope this will be able to provide you with something that you will remember and you will learn from po. That's not full length, but something that's very valuable. So this formally closes po our webinar for the week. Magkita-kita po tayo again next Friday from 12 noon to 2 p.m. It's a day.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.